Hi, I'm Martha Newsome, and I'm here at the mHealth Summit. I'm responsible for World Vision's Global Health Program and a member of the mHealth Alliance Board. And I'm here with a fellow board member and also the Associate Director of Applied Technology with the Rockefeller Foundation, Karl Brown. So, Karl, good to be with you today.
Hello, Martha. How are you?
Good. So, Karl, I understand that you have interest in the intersection of mobile finance and mobile health. So, tell me a little bit about that.
Sure. So, I think if you look around the world at the mobile services which have scaled the most, which have reached the most people, and which have been designed in a way so as to be sustainable, some of the most successful models are in mobile finance. Mobile banking, money transfer, mobile money, and so on. And this is an industry that's a few years older than the mobile health, and they have a much broader scale. They've achieved a much broader scale. So there's a couple reasons that we're interested in this intersection. First of all, just what can mobile health learn from mobile finance about sustainable scaling of solutions that reach consumers and provide them with things that they value.
Sure.
So that's a first lesson of how do you do something like scaling. And what does it take at a country level? And there's been a lot said about M-Pesa, but there's also mobile money services that are starting to ramp up in other countries. So that's one thing. But the other, I think, more interesting wrinkle is how can bringing lower transaction cost financial transfers change how the health system is structured, or change how payment and compensation and incentives are aligned within a health system. We all know that at the end of the day, money makes the world go round. Unfortunately, that's sort of the case. But at the Rockefeller Foundation, we also believe that one of the most transformational potential health sector reforms that's going on right now is a reform of domestic financing. You know, you look at a country like Thailand, which now has basically achieved universal coverage.
True.
And there are not medical bankruptcies in Thailand. It just doesn't happen. There are not medical bankruptcies in most countries in Europe. But it happens in America all the time. It happens in Pakistan all the time. If you're just focused on increasing access to services without sorting out the financial aspect, you're not going to have a sustainable system.
You'll never get there.